And welcome back to Med School Radio, and we're looking at case number 6. Case number 6 from the first aid book, and so let's read it. A 55-year-old man comes to his physician for a follow-up visit after being hospitalized 2 weeks earlier for an inferior wall myocardial infarction, or an MI. The patient has a history of coronary artery disease. His EKG, his ECG, is shown in figure 5-5. You can't see it. So sorry about that. It's on page 123 of the first aid cases for the USMLE. And this is the 3rd edition. What pathology does the ECG in figure 5-5 depict? Second degree atrioventricular AV block type 1, also known as Morbitz type 1 block or Weckenbach block. So we have some pictures of it here. This Morbitz type 1 or Weckenbach block. This is a progressive lengthening of the PR interval from one beat to the next. And this is seen until finally a beat is dropped, which means that a P wave is not followed by a QRS complex. So going back, what is the pathophysiology of this condition? Second degree AV block type 1 occurs secondary to impaired conduction at the level of the AV node, such that atrial impulses fail to reach the ventricles. And given the location of the patient's prior MI, it is possible that it may have compromised the conductive ability of this AV node. An MI involving the right coronary artery may disrupt blood supply to the sinoatrial node and atrioventricular node. By contrast, involvement of the left anterior descending coronary artery, the LAD, causes infarction of the His Purkinje system. So now let's talk a little bit about how this condition is classified. First, in first degree block, the PR interval is prolonged, but there are no missed beats, which means that the QRS complex follows every P wave. So let's take a look at first degree block. I don't know if you can see this. This is first degree heart block. And again, the QRS complex follows every P wave, and there are no missed beats. How about for second degree block? Okay, for secondary degree block, there is an intermittent failure of AV conduction. In a Morbitz type 1 block, Morbitz type 1 block, the PR interval progressively lengthens until a beat is dropped. In a Morbitz type 2 block, okay, this is the Morbitz type 2 block, there is a sudden loss of impulse conduction without a corresponding change in PR interval. The Morbitz type 2 may progress to more serious arrhythmias such as complete heart block. How about third degree block, which is also known as complete heart block? Okay, so take a look at this. This is third degree block, and here there is no conduction via the AV node. The atrial impulses do not reach the ventricles, and the ventricles beat at their own intrinsic pace. And on ECG, this is reflected as P waves and QRS complexes occurring independently of each other. So what is the appropriate treatment for this condition? Often no treatment is necessary in asymptomatic patients with a second degree Morbitz type 1 block. In symptomatic patients, atropine or isoproterenol may be used, or a pacemaker may be required. Okay, so that was it for heart block. Watch this again if you need to, and comment. Thank you.